Good afternoon. My name is Marion Graham, and I'm the Director for Catholic Schools, and it is my pleasure to provide you with the Catholic Schools update. Today, I'd like to share where our schools are now and what the 21-22 school year might look like. First and foremost, I am proud to share that since the fall, all our Catholic schools are open with in-person instruction. Our preschools opened in August, our elementary schools opened in September and October, and our high schools opened in November. Since the fall, we've been able to continue to offer in person on campus instruction because of our strict adherence to CDC, state, and county guidelines. This has been no easy feat, and it has been a collaborative effort with our parishes, parish leaders, our parents, faculty, and students. On behalf of the Catholic schools, I want to thank all of you, our pastors and parish leaders, in allowing us to open in accordance with the reopening plan and to continue to stay open safely. The California Department of Public Health recently put out a report regarding what can be expected for the 21-22 school year. This report is based on data that they collected from schools like ours that have been open and operating safely for the past few months. This report is based on 5 key factors, and I'm going to share 2 of those with you. Research and understanding. What we know now is that children are not major vectors. In-school transmission can be minimal with the adherence to precautions, and masks are very effective. In August of 21, it is projected that we will have more tailored and targeted precautions, meaning we may be able to eliminate some of the protocols that we are currently using and concentrate only on a few key and more effective protocols to mitigate the virus transmission. We also know that continued mask wearing will be required in the new year, but we do not know to what extent. Currently, all students K through 12 must wear a mask indoors as well as outdoors if they cannot remain 6 feet apart. We also know that testing and contact tracing will be part of our regime. With regards to vaccines, all school staff were offered the vaccine. In our diocese, like across the state, most of our teachers have been vaccinated, but not all of them have chosen to be vaccinated. As we as a diocese are not requiring vaccinations of our staff, nor do we anticipate doing so going forward. We also know that as of April 15th, students who are 16 years or older are eligible to be vaccinated. We do not know how many students have been vaccinated to this date or wish to be vaccinated. By August of 2021, it is anticipated that the accelerated rise in vaccination rates will help us keep our school members safe, particularly those who are at high risk. Right now, we have families who are still concerned with returning to campus and therefore access instruction remotely. The potential increased vaccination rate may make them feel more comfortable and more inclined to return to in-person instruction. We are also understanding that as early as this August, a vaccine is to be available to students ages 12 to 15. So what does this mean for us? We are happy that based on the current trends, it looks like we will be able to begin the school year offering in-person instruction to all students. This is great news, as last summer, our principals and teachers had to plan for 3 scenarios for the start of the school year: fully remote, fully in person, and also a hybrid model. We also understand that there will still be guidance in place for next year, but that guidance will be revised on the most current conditions. If the vaccination rates increase, then perhaps we will have less restrictive protocols in place. For example, no masks outside. However, if variants emerge, there could be a possibility that more restrictive protocols will be in place, or we will have to return to some of our previous protocols, such as requiring 6 feet between students in the classroom. Now what? Last year, about this time, we were talking about concerns with sharing facilities across parish ministries. It was believed that surface transmission was a major concern. Because of that, our schools were required, as part of a reopening plan, not to allow non-school related organizations to use the facilities. Sharing of materials and equipment was to be avoided, and cleaning and disinfecting was a part of a very strict regime and had to be done often. Since that time, we have learned that transmission through surfaces is limited and not a major concern. It can happen, but it is not a primary source of transmission. So now, many of you must be asking, when can we get back into the parish buildings? I reached out to our county public health officials with this question in mind, and here's what they shared. Since official guidance for next year is not out yet, we still need to wait and see what will or will not be allowed. Yet, from what they are seeing at the moment, they believe that sharing of classrooms and buildings will not be a concern. However, as variants and trends emerge, the conditions, protocols, and guidance could change. They advise that although surface contact is not a primary source of transmission, cleaning and disinfecting of classrooms between groups and classes should be done, particularly as we're dealing with children. For faith formation classes, this would mean that after school, the classrooms should be cleaned before faith formation classes begin. After faith formation, the classrooms and buildings need to be cleaned again in preparation for the next school day. If faith formation holds 2 classes a night, classrooms should be cleaned between each class. In addition, masks should be worn, stable groups should be enforced, adults should remain 6 feet from children at all times, and hand hygiene should be encouraged. The San Joaquin County Public Health also shared that it is likely that faith formation would need to follow the school guidance, not the cohorting guidance. The only exception would be that instead of using the current guidance of 3 feet between students, faith formation would be encouraged to keep keep with the previous guidelines of 6 feet between students so that they can reduce the need or the extent of contact tracing. It must be noted that 6 feet distance in the classroom from student to student will impact maximum class sizes. It was also mentioned that as part of the contact tracing, seating charts need to be very clear and consistent. Attendance needs to be carefully monitored. Break times, the entering and exiting of students and staff will also need to be monitored. Mixing of groups and classes will need to be avoided at all times. Training would need to happen, particularly for contact tracing procedures and how to report positive cases to the county. For our public health officials, the major concern was not the sharing of classrooms, but the impact of a positive case in a faith formation class. For example, if there is a close contact exposure in a faith formation class and students in the class come from 5 different elementary schools and possibly 5 schools but 8 classrooms, one positive case in faith formation could potentially require the quarantining of all those 8 classrooms in the public school system. In addition, it could potentially impact exponentially many families. So there does seem to be a break in the COVID storm in terms of using facilities, but there are still many obstacles that need to be tackled for there to be truly blue skies. Thank you.